This is Christian Marold, Executive Director of HealthManagement.org. Welcome to another Digitalk with Anjum Ahmed, Chief Medical Officer and Global Director of Imaging IT Solutions at Agfa Healthcare. Anjum, how have you seen artificial intelligence change from hype to reality over the last few years?
Thank you so much for the opportunity. And it's a very relevant question today, because when we started hearing about artificial intelligence in healthcare, more specifically in diagnostic imaging itself, there was this hype around AI that it will come and replace the radiologist or diagnosticians, and it will take over the work that they do. And there were even new, upcoming resident radiologists or students who were looking for a career in radiology, asking, would I even have a career in radiology, or should I train in radiology because AI is going to do the work that radiologists are doing? I think we are past that hype, and what we would say is the reality has dawned upon us, because what we have learned and realized is that with the practical application or evaluation which the industry went through of AI use cases, the clinical community or radiologists have realized that AI works with them and helps to address some of the pressing challenges that they have in relation to, some automation, fast image analysis, something that what the machines are good at. And I've seen that those AI developers or solution providers who are following this augmented intelligence philosophy are a bit more successful, because the way we look at it in terms of what we have done is how we integrate AI into the clinical workflow. Because just to simplify this, what we have learned is AI generates a lot of data. And this data that AI or the black box or that AI server generates, you need to do something with this. And what the radiologists and clinicians have been asking us is, how can I use this data to optimize my day-to-day work? And in that day-to-day practice, we have realized that, the access to images, fast access to images, fast access to relevant screening images that the radiologists are interested in, or automated comparisons, because you need to do something with that image if AI is showing some results. So the way I defined the whole scenario, artificial intelligence versus augmented intelligence, is that the augmented intelligence is the intersection of machine learning algorithms and advanced applications where clinical knowledge and medical data converge on a common platform. So that's where we need to look at AI in terms of how it is bridging the gap between the clinical knowledge and the productivity or the other challenges that they have with automation. So the first thing, in summary, the industry has realized that machines are very good at speed and performance. So if those machines can be used to automate some of the tedious tasks that the radiologists are doing day to day, which they spend a lot of time on, and if those tasks can be handed over to machines, that's good. So that means the early adopters of these systems who have tested these, they're telling us, well, if I was reading a chest CT scan, let's say, trying to find a nodule or the specific findings, 12, 13 minutes. Now, because of AI automation, because of things that AI can do, automated measurements, automated detection of nodules, nodule characterizations, that we are saving 30-40% of our times, and we are much more faster. And that's where health systems will begin to realize productivity. So I think the way to look at it is the realistic approach of AI is implementing AI into clinical practice. And the good news is, because there was this initial reluctancy where clinicians were trying to doubt the benefits of AI, but when they started testing and validating AI, that's how the clinical scenarios of workflow improvements kind of came about. And then there are advanced technologies as well being built with artificial intelligence into more predictive intelligence, so that clinical decision support becomes much more easier. So I think the good news is that the way we see the future, there will be more physicians who will be using AI applications as compared to those who are not. And that's where I think it is important that the clinicians join this bandwagon of AI, because the more clinical input is there, the more we can influence AI developers to be able to be more relevant in clinical workflows.
What are the 3 winning arguments where you can convince customers about AI?
That's very interesting you asked this, because it relates to what I mentioned in the beginning regarding how we have come out from the hype to the reality of AI. So the winning arguments that we have seen work is, number one, if you position AI not as a feature functionality tool, but as more of a tool that helps improve clinical programs. So you have to look at it in the context of the clinical program that the hospital or the department is trying to improve. So let's say if you're an academic institute, you're doing research and clinical practice. So you may have a cancer screening program going on for, let's say, lung cancer screening or breast cancer screening, or you are a primary care center, you're doing a lot of screening, let's say somewhere in Middle East or somewhere in a country where chronic disease are prevalent. So depending upon the use case that you have in mind, and if you position the use of AI application in its clinical context, that's where it brings more relevancy, not only to the, let's say, radiology department, but all the clinical care pathway, because that's where we have seen that the clinical directors, for instance, or the chief medical officers in healthcare organizations are looking at improving some of these programs. So that's one aspect in regards to the applications and the usability of AI in clinical practice. The other aspect, as I mentioned, is the winning argument is, what we have learned in the past is, and what we are seeing today is, there are hundreds of AI startups and developers who are developing AI applications. And the customers ask us, how do I decide which AI is good for me? Because there are 150 plus AI developers out there, and maybe there are 5 or 10 different AI applications for the same clinical functionality. So how do we go about it? And that's where the second argument becomes more relevant, is the workflow. That how do we embed these multiple AI applications into a clinical scenario? And that's where the clinical program approach, which I mentioned in the beginning, the first argument, helps with the second argument, answer the second argument, which is embedding it into the workflow, creating clinical packages. And that is what we have done with our approach with Ruby for AI, this framework that we have developed, so that we can work with multiple best of breed AI developers. And as a front end, when we provide the PACS solution to the customers or enterprise imaging solution, that the users benefit from these multiple applications, AI applications, that are seamlessly embedded into their workflow. So that's important, and that is what the clinicians are actually trying to understand now. Should I go, partner with AI directly, or should I work with my enterprise imaging solution provider? And that's something that is being learned now, that it helps improve better workflow and functionality. So AI should not be a separate box or a silo. It should be part of their workflow. And the third aspect is absolutely in relation to developing and understanding the key outcomes that you have improved. Because, I would say, oh yeah, there are 5 different AI applications for the same use case, but so what if it has a high sensitivity, specificity? Because the industry today has a lot of retrospective data in regards to how the algorithm was trained and developed and tested. What the industry doesn't have today is what we call as prospective data or prospective studies in terms of when the AI was implemented, what clinical outcomes were the department or the hospital able to improve. And that's where we work with our early adopters to establish some benchmarks and KPIs so that they can actually monitor that before and after of AI, basically. so that they can justify the business case of that particular investment. In certain cases, it could be improvement in clinical quality, early disease detection, improved productivity. They may have capacity and resource challenges in terms of clinical staff or radiology staff or technicians. And that's where, we come out with metrics relating to improved productivity, early detection of, abnormal findings, and also because of that, what was the impact on the entire patient care pathway. So I think these three factors, if you keep in mind, it brings about a good, strategic approach in terms of not only how you position AI for new prospects or customers, but also how you work and partner with your existing customers to build those clinical studies or case studies, so that it is a win-win situation for hospitals or health authorities, that what are they doing with these advanced tools for their patients and population, and for the solution providers like enterprise imaging solution providers like Agfa, that how their technology is enabling some of these latest innovation into clinical practice.
Thank you very much for this great, insightful talk. I really learned a lot about this, and indeed, you have created a very interesting platform with Agfa Healthcare. Thank you very much for watching the HealthManagement.org Digitalk with Anjum Ahmed. Please subscribe to the HealthManagement.org YouTube channel, as this is the only way to ensure that you are on top of management, leadership, cross-collaboration, and winning practices.